everyone. It's great to have you here at Einstein's Eyes, our ophthalmology-centric YouTube channel. I'm your co-host, Carl Rosen, oculoplastics, neuro-ophthalmology in Anchorage, Alaska. Over 3 decades, I'm with my friend and co-host and former Albert Einstein College of Medicine resident in the ophthalmology department, Jon Ditkoff. Jon?
Hello, everybody. I'm Jon Ditkoff. I am a general ophthalmologist, cornea specialist practicing in northern New Jersey for 31 years. I met Carl quite a while ago when we did our residency together at Albert Einstein, hence Einstein's Eyes. And it's really interesting. We have an interesting topic for you today. Not really clinical, not really something we can talk about using yet, but it could be the future.
Right.
So I'll let Carl introduce that.
On this channel, we talk about topics that are not relevant at the moment, but have potential. Relates to VP1-001. It's a compound that's very fascinating, and it's really going down a new avenue in cataract research, also known as compound 29, an oxysterol. An oxysterol is an oxygenated cholesterol molecule that a team at Viewpoint Therapeutics has been investigating. And what's unique is that when applied as an eye drop in mice, it partially restores lens transparency. When I mean transparency, I mean let's look at a cross-section of the eyeball. And here is the lens. So it's a structure that's normally transparent.
Just to help everybody in the audience, transparent means clear.
Exactly. So it's a clear, flexible disc that focuses light onto the retina, which is in the back of the eye, to create sharp images. It's located behind the pupil and in front of the vitreous, which is the jelly in something called the posterior part of the eye, the posterior segment. It accommodates and allows focusing to occur. Now, as we age, it gets harder, and it's made of these things called crystalline proteins, alpha, beta, and gamma. VP1-001 has shown in mice to improve 61% of these treated lenses as far as clarity goes. It works by binding to the αB-crystallin, as I was mentioning, a protein that helps keep lens proteins from aggregating and from becoming denser, less transparent, so light can't get through, results in a cataract. Now, what's interesting is that its mirror image, it's something called an enantiomer, VP1-001, does not bind and does not improve vision. Now, an enantiomer is like having a glove, a right-hand glove and a left-hand glove. They're mirror images, but they don't do the same thing, which is really interesting. Binding specificity seems key. The compound also helps dissolve protein clumps and improve the solubility of key crystallins in the lens. And I mentioned before, the crystalline proteins create the lens. When we're young, they're clear. So alpha, beta, gamma crystallins, they're all crucial to clarity and function. Despite the promise, we have to remember it's still preclinical, and the territory is preclinical. So although it shows promising results in mice and in ex vivo human lenses, meaning lenses that have been removed during cataract surgery, they've been experimented on in a lab, no human trials or FDA approvals yet exist. But the concept is compelling. I mean, imagine a drop that would get rid of cataracts and make your lens clear again without surgery, without what we do currently, which is phacoemulsification. So looking ahead, what are the steps needed to bring VP1-001 closer to clinical use? Well, we need to verify its safety for cornea and ocular tissues. We need to advance these randomized masked animal studies, go to human trials, and that's the ultimate goal, is to design a human trial and get FDA approval. But we are looking forward to an eye drop that can treat cataracts. Jon, what do you think?
Well, it's interesting because for over, I've been in practice for over 31 years, and multiple times I've had patients come in and tell me about a friend of them told them to use an eye drop or some magic potion to get rid of their cataracts or to prevent cataract formation. And as far as I'm aware of, there's nothing. I think we always tell patients to protect their eyes from the sun and eat a healthy diet and all these kind of miracle things that we're looking for that are anti-aging. I mean, aging is the most common cause for cataracts, just like it causes many other issues we have in our bodies. So this is exciting. I mean, anything that decreases age-related disease in the body, let alone the eye, very exciting. And I'm sure there's other forms of this that they're trying for other issues that occur with age, such as hip issues and arthritis and knee issues and hearing loss. And so all these kind of things that I'm 61. I'm hoping they fix it all by the time I'm 80, so I don't have to deal with it. But I don't think it's likely, but it's exciting. As Carl said, we thought this was a great topic just to bring up because so many people ask us about it. We're trying to share that with everybody, but I think we're not, ready to prescribe this, of course. But we all should be following the studies and see what happens with this new medication.
Right. So we'll keep you up to date, and maybe we won't be doing cataract surgery in the future. Thanks, guys, for being here. Until the next one, John, great seeing you. We'll talk to you soon. Bye.